So if I've bought the machine because I have a prolapse, what would be your advice for me? How best can I use it, and are there other things that I need to consider?
Well, prolapse can be a little bit confusing because we aren't actually trying to jack the prolapse back up with our muscles. I think sometimes we think, well, things are falling down. I've got to use my muscles to push that prolapse back up. Unfortunately, we can't do that. You might get some temporary relief, but a prolapse will want to fall down again. What we're trying to get the muscles to do is rather make a really nice shelf that's going to, the minute you get out of bed in the morning, be there and support everything, so that all the pressures of the day that want to push the prolapse down come up against this much improved floor. And it's that floor that acts as a support so that nothing can shift. And then on top of that, if you were going to cough, or if you're going to pick up something heavy or carry a child or a grandchild, then you want to be able to up your game a bit and have some extra muscle support, so that you know that your internal organs that are sort of held up by little bits of elastic, that they can't get pushed down any further. So actually, it's not dissimilar to the work that someone with stress incontinence would need to do. You want to strengthen your muscles, and you want them to work harder and more than you can normally work them, so that they're forced to grow. And as they grow, they get thicker, and that levator plate, the layer of muscles underneath, gets thicker and firmer and supports things better, and it doesn't tire as easily. And if something else comes along that's going to be a bit more stressful, they can go up a gear and they can work a bit harder for a few minutes, and then they can settle back into a nice resting place, not just go all floppy. So often we would encourage someone who's got prolapse to choose the same programs as someone with stress incontinence, but we're doing it for a different reason. They want to build their muscles to build up this endurance and strength. So you've got programs that just do the sort of optimum fast and slow twitch together, which we talked about earlier, program 10. Program 11 has got 2 phases, which are a little bit more biased towards the slow twitch endurance fibers in the first phase, and then more the fast twitch fibers in the second phase. So I think that would be quite a good program if that was your goal, just generally getting all your strength and endurance fibers working.
So it's a case of almost of managing that prolapse, making sure it doesn't get any worse, it doesn't drop down, there's not further deterioration.
Yes, so your muscle strength is part of a package of things you want to do to try to help your prolapse. So you want to have this nice support shelf, but you also want to look very carefully at your lifting and carrying. You need to have strong arms and strong abdominals so that you can lift and carry better. You also need to maybe pick and choose what you're going to lift and carry a bit more, especially in the garden. So you're not going to be the person wheeling the wheelbarrow up and down the garden full of compost if you've got a prolapse, because that's, no matter how good your muscles are, they'll never cope with that. And then also it's things like making sure your bowel empties well so that there isn't pressure on the organs from inside. It's looking after a cough, so that if you've got a cough, you're trying to get it gone rather than having one of those coughs that goes on for months and months. And also with prolapse, if it's come at that time of life when you're in the perimenopause, it's really important to look at the quality of the tissues and be talking to your GP about whether you've got some vaginal atrophy that needs treating, or could do with a bit more moisture in the area as well. So it's a package of care, which muscle strengthening is a part of that package.
Thank you.